Good morning. I'm Dr. Susan Howell, and I'm the Director of Professional Practice, Specialty Services, and Infection Control here at St. Joseph's Campbell. And on behalf of Dr. Sherry Dinello, our Chief Nursing Officer and Vice President of Patient Care Services, and all of the rest of the nursing leadership in the organization, welcome to St. Joseph's Campbell. I'm here to talk to you this morning a little bit about the magnet program that we have here at St. Joseph's Campbell. This is the schematic of the magnet model. And I'm going to go into depth a little bit about this because it's important that you have this information. So what you see before you is the schematic. There are 5 components, and surrounding those components is the oval that speaks to global issues in nursing and healthcare. And what this references is that healthcare is changing so rapidly and is so non-static that we really can't predict what things will look like in the future. How healthcare has looked in the past and how it will look in the future is totally different. So that is just a realization of that fact. So within the actual model, the first one I want to spend a little bit of time on is transformational leadership. And transformational leadership references how well our nursing leaders and organizational leaders move us to where we need to be in the organization and in healthcare, not necessarily where we want to be. It's very easy to be comfortable where we are right now. None of us particularly like change, but we're going to have to embrace change because that is the future. Structural empowerment is the second component, and structural empowerment references the structures and processes that are in place to support a professional nursing practice. In a magnet facility that has been designated as many times as we have just are undergoing our 4th designation right now, it is assumed that those structures and processes are in place. And we'll talk a little bit about those as we move forward. Things like certification bonuses, professional development opportunities, shared governance. All of those are structures and processes that provide a professional practice base. Exemplary professional practice is the third component, and that component is really the hallmark of Magnet and references how we actually operate in the healthcare arena. What do we do, how do we do it, and what difference do we make? That's really the important piece about what we do as nurses in healthcare. And the fourth is new knowledge, innovations, and improvements. A real sign of a profession is the ability to give back to that profession. And so through our evidence-based practice, and Nursing Research Council, as well as other mechanisms we have in the organization, we strive to embrace what is current and what is going to happen in the future and conduct research and quality improvement activities to support that new knowledge. And the real meat of Magnet, I think, is the empirical outcomes, and that is what is in the center. And the empirical outcomes is truly the so what. The so what of Magnet, the so what of what we do every day. What are the outcomes? Patient outcomes, patient satisfaction outcomes, clinical outcomes, and we're going to talk a lot about that today. That is really why you are all here, to look at what we have changed at St. Joseph's Campbell in order to push our empirical outcomes forward and continue to outperform other Magnet facilities. So as I said earlier, transformational leadership really focuses on accountability and organizational scope. So those are the things that we look at in terms of where our nursing leaders are in the organization, how well they're academically prepared, are they nationally certified, what involvement do we see with them in organizational issues. Structural empowerment. There is an IOM, Institute of Medicine, recommendation that by the year 2020, 80% at least of our nurses are baccalaureate prepared. And I'm happy to sit here today and tell you, or stand here today and tell you that we're over 67% on both of our campuses. So that's really good information. Certification. Certification provides another level of expertise for a nurse. It really shows that a nurse has embraced lifelong learning and has gone above basic licensure to be able to expound on their own knowledge and provide that expertise to their patients. We offer certification bonuses, certification scholarships, as well as study groups and information through our online programs. Shared governance is something we have had in place even before we were a magnet organization. And you'll learn about some of this today. Many of the things we'll be talking about really were born out of our Nursing Quality Practice Council, as well as our Evidence-Based Practice and Nursing Research Council, as we looked at best practices and how we could move our indicators forward. Advancement, clinical ladders, other opportunities for advancement in the organization are profound. We have a lot of opportunities to look at things you may want to do. If you have a special interest, we want to help support that, whether you want to go into leadership or clinical education or remain at the bedside, being the best bedside nurse you could possibly be. We are here to support you with that. And then education. We have CE Direct, which is our online program. It has Pearl CE, which provides certification and other types of ongoing education. We're looking at other opportunities in the future as well for some additional educational opportunities. Well, I would be remiss if I didn't mention just a little bit about Florence Nightingale. Several years ago, one of the requirements of Magnet was that each organization had a nursing theorist. And at that time, we did a lot of work to focus on who were the nursing theorists of the day, what did they embrace, and what did they really talk about. So we had the faculty from the area schools of nursing come and talk about this. We did a lot of focus groups with staff, and then at the end, we voted on which theorist the nurses felt best exemplified the practice here. And I'm really happy to say we had over 400 nurses that voted, and it was unanimous, Florence Nightingale, the mother of nursing. And I really am proud of that because she was not very conventional for her day and was quite the rebel and quite innovative, was the first nursing statistician, and really promoted the back to basics, the evidence-based processes that we're still involved in today. And she said, every nurse ought to be careful to wash her hands very frequently during the day. And we'll be focusing on hand hygiene and a lot of other infection control and prevention practices through this day. So I do want you to keep thinking about Florence Nightingale. Exemplary professional practice. Our policies and procedures are all evidence-based. We have a very active and robust patient care policy committee, and you are all invited to join that if you would like. Nurse-driven protocols. We were very early adopters of the nurse-driven Foley removal protocol. We now have a C. diff protocol, and we're working on a urinary retention and straight calf protocol. And evidence-based practice, again, as we talked about, truly is a hallmark of a magnet organization. New knowledge, innovations, and improvements. Nursing research and dissemination, I've already mentioned. Nursing quality, one of our nursing governance councils that we have. We're very focused on nursing governance and nursing quality in all sorts of venues, from organizational programs such as our committees, such as Infection Prevention and Control, Quality 2020, to the Quality Analysis and Implementation Committee. And so all of us are involved in that at some level. And then NDNQI, which is the National Database of Nursing Quality Indicators. We submit quarterly to this database out of the University of Missouri nurse-sensitive indicator data, and we're going to talk about that in a minute. Falls with injury, pressure injuries, stage 2 and above, central line-associated bloodstream infections, and catheter-associated urinary tract infections are some of the data elements that we report. We benchmark ourselves against magnet hospitals, and our goal is to outperform all of those. So here we have them again, and in addition, C. difficile and MRSA bacteremia. So we've made a lot of strides over the last year, really last 18 months, in 2017 and the end of 2016, to focus on these elements and to see how we could continue to improve and standardize our processes using high reliability processes. So we have done a lot of that work. You're going to hear a lot about that today, and we'll be actually practicing some of this work as we move forward. Here's an example of a scorecard that you will see on your unit. This is St. Joseph's. We update this every quarter. Green is good, red not so good. But this shows us at the end of the second quarter of 2017, for example, where we fell with our nurse-sensitive indicators. And you can see that we did very well with everything, and even we still outperformed with CAUTI, but we knew that was our #1 area for improvement. And here's the Candler one as well. And you can see still CLABSI here might be the area that we want to focus on more for this quarter. So you will see this on your quality boards, up on your units, and as I said, this is updated every quarter. I think that's my presentation. Do you have any questions? Well, you can't ask me, can you? Because I'm on video. But all of the members of the clinical quality team and the unit-based educators that are here to help will certainly be able to answer any of your questions. In closing, again, welcome to St. Joseph's Candler. I hope you enjoyed this day and learned a lot. And I'm sure we'll be talking again soon. Thank you.